Hello everyone, myself Dr. Ravi Keshri. Please share, subscribe and like my video. Today I will discuss about the muscles of the larynx. In the previous section, I have discussed the saccule of the larynx, the laryngeal inlet, then cavity of the larynx and different cartilage of the larynx. Today I will discuss about the muscles of the larynx. They are the different muscles of the larynx. Some are the cricothyroid muscles, which has the oblique part and the straight part. Some are the vocalis muscles, and each muscles, oblique arytenoid muscles, the transverse arytenoid muscles, and each muscles have the different origin, insertion, the nerve supply and the action. Now just like the cricothyroid muscles, one has the oblique part, the straight part. Other muscles are the aryepiglottic muscles, thyroarytenoid muscles, and also the transverse arytenoid, the oblique arytenoid, posterior cricoarytenoid and lateral cricoarytenoid. These are the different muscles of the larynx. Just like the cricothyroid muscles, origin is from the anterolateral aspect of the arc of the cricoid cartilage, and the insertion, the oblique part, on the lesser horn of the head. The head bone has the body, the greater horn and the lesser horn. The oblique part is inserted on the lesser horn, and the straight part on the inferior margin of the thyroid cartilage. Just like the cricothyroid, origin of the cricoid and insertion of the thyroid cartilage, and innervation is by the external branch of the superior laryngeal nerve from the vagus nerve. Function is by the forward and downward rotation of the thyroid cartilage at the cricothyroid joint. Forward and downward rotation of the thyroid cartilage at the cricothyroid joint. Next is the posterior cricoarytenoid. Origin is from the oval depression on the posterior surface of the lamina of the cricoid cartilage. That is the origin. Insertion on the posterior surface of the muscular process of the arytenoid cartilage. Posterior surface of the muscular process of the arytenoid cartilage, and insertion is by the recurrent laryngeal branch of the vagus nerve, and function is by the external rotation and abduction of the arytenoid cartilage. External rotation and abduction, that is the function. Next is the lateral cricoarytenoid. Origin is from the superior surface of the arc of the cricoid cartilage, and insertion on the anterior surface of the muscular process of the arytenoid cartilage, and innervation is by the recurrent laryngeal branch of the vagus nerve, and function is by the abduction and internal rotation. The lateral cricoarytenoid has function abduction and internal rotation, and the posterior has the external rotation and abduction of the arytenoid cartilage. Abduction of the arytenoid cartilage. External rotation by the posterior and internal rotation by the lateral cricoarytenoid. The lateral cricoarytenoid on the superior surface of the origin is on the superior surface of the arc of the cricoid cartilage, and insertion on the anterior surface of the muscular process of the arytenoid cartilage. Recurrent laryngeal innervation is by the recurrent laryngeal branch of the vagus nerve, which is the 10th cranial nerve, and function is abduction and internal rotation of the arytenoid cartilage. Next is the transverse arytenoid. Origin is from the lateral border of the posterior surface of the arytenoid cartilage, and insertion on the lateral border of the posterior surface of the opposite arytenoid cartilage. This is very important. This is the opposite arytenoid cartilage. Opposite arytenoid cartilage. And nerve supply is by the recurrent laryngeal branch of the vagus nerve. Lateral border of the posterior surface of the opposite arytenoid cartilage. Innervation is by the vagus nerve, recurrent laryngeal branch, and function is the adduction of the arytenoid cartilage. This is the transverse arytenoid. Next is the oblique arytenoid. Origin is from the posterior surface of the muscular process of the arytenoid cartilage, and insertion on the posterior surface of the apex of the adjacent arytenoid cartilage extends into the aryepiglottic fold. And nerve supply is by also by the same the recurrent laryngeal branch of the vagus nerve, and sphincter of the function is sphincter of the laryngeal inlet. Sphincter of the laryngeal inlet, that is the oblique arytenoid. Next is the thyroarytenoid muscles. Thyroid angle in origin is from the thyroid angle and adjacent cricothyroid ligament, and insertion on the anterolateral surface of the arytenoid cartilage, and some fiber continue into the aryepiglottic fold to the lateral margin of the epiglottis, and nerve supply is by the declension branch of the vagus nerve, and action is the sphincter of the vestibule and of laryngeal inlet. Sphincter of the vestibule and the laryngeal inlet. Next is the vocalis muscles. Origin is from the lateral surface of the vocal process of the arytenoid cartilage, and insertion is the vocal ligament and the thyroid angle, and nerve supply is by the recurrent laryngeal branch of the vagus nerve, and function is adjust tension in the vocal cord. This is all about the function of the muscles of the different muscles of the larynx, and different origin, insertion, the function, and the nerve supply.